You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. I run a clinic there called Evolve Dental, and we provide safe amalgam mercury removal, holistic dental care, and advice for your health and well-being. I'm a dentist with over 30 years experience, and I've been working holistically since around 2001. And in that time, I have helped thousands of people just like you have healthy, mercury-free, metal-free, beautiful smiles for life. This is the Dental Zone podcast. I really appreciate you joining me. Thanks for listening. Let's get in the zone. Let's get on with the show. Today I'm going to talk about Evolve Dental's 6-step amalgam removal process and why we always do a amalgam removal consultation first before we begin any treatment. Well, it's really important that if your amalgam fillings are going to be replaced, that it's done so safely. Now, for those of you who this might be the first time joining me, amalgam fillings are the silver fillings that are often in your back teeth. They're a mixture of silver, copper, tin and zinc, and around 50% mercury. Now that mercury will leak and vaporize out of the filling for the lifetime of the filling, which tends to outlive you, the human being. And that mercury is a toxic heavy metal, which can be very detrimental to people's health and well-being. So when those fillings are being drilled, they actually release a huge amount of mercury vapor up into the dental room, which you as the patient is breathing in. You're also getting splattered in particles and bits of the filling inside your mouth, which you'll absorb and swallow and ingest. And this is a very big exposure to mercury, which your body is not designed to handle. So we have a safe amalgam removal process. We're also SMART certified, which means safe mercury amalgam removal technique. And we want to ensure that we help our patients to do this process safely, to stay well, and to be able to detox their body of any mercury that has been dumped and stored within it. So it's important that your amalgam fillings are removed safely. It's also important that we do this in a way that takes into account not only the health and condition of your teeth and gums, but also your health and your health history. Because your body needs to be able to recover between each amalgam removal session, because it's going to be going through a detox process. It's actually going to be mobilizing mercury that's been stored within your cells and tissues. And you want to be able to begin to detox that and any other toxins that are there. And each person is individual, so we've got to take each case on its own merit. So we need to assess you, your health, your energy levels, your diet, your nutrition, what fillings you have, what's going on in the rest of your body, stress levels and so forth. So this is why we always want to see you first and do a thorough amalgam removal consultation prior to starting any treatment. So we have a 6-step process. Step 1 is hopefully you've rung and you've booked and you've chatted with our team, you understand what's involved and you're booked in to come and see me for your consultation. Once you book in, we send you a welcome pack, and within that there are ebooks and information on amalgam fillings, mercury and the impacts on your health and well-being, so that you can be informed and educated and empowered when you come for your consult. It allows you to have a lot of your questions answered beforehand, so that the time we have together is best spent answering your specific details. So then step 3 is we do the amalgam consultation. Now that's a private consultation with me where we go through what amalgam removal is, have a look, do a wellness check of your mouth, look around, see if there's any gum disease, infections, tooth decay, problem teeth, breakages. We're also going to see how many amalgams you've got, where they are in your mouth, how big they are, how deep they are. And I'm also going to check for any hidden amalgams by making sure we take x-rays to make sure there's nothing left underneath some of your existing fillings that may already have been switched over for white ones. We'll then do step 4, which will give you information about your at-home detox program, provide you with information, any recommendations or referrals if you need support with a naturopath or naturopathic doctor or integrative GP. After that consultation, you'll be given a customised treatment pack, and then step 6 is we go on and we start your amalgam removal sessions at another visit and get you to a point where you have amalgam mercury-free teeth. So let's talk a little bit more about the consultation process today so that you understand what's involved. So during the consultation, we take a detailed medical history. We need to ascertain your health, medications you might be on, any health issues you've had, the overall state of your health and well-being, your energy levels and so forth. We want to consider any stresses that you may have on your body, any allergies or issues that may impair or impact on your immune system, your digestive health, liver function, and your ability to detox and be well during the process. As part of this consultation, as I say, I answer any questions, I explain how the process happens, what we actually do during amalgam removal. But at this consultation, it's an opportunity for me to get to know you to get to know me and my team. We examine your mouth, your teeth, your gums, we have a look at your jaw joint function, your bite, we determine the number of amalgams that you have, their size, complexity, the strength and condition of the teeth that these amalgams are in, and we'll use dental x-rays where we need to, because we need to be able to check what's going on, rule out any decay, infection problems, and also check for any hidden amalgams. During this consultation, I'll discuss the process of amalgam removal in detail, the implications of mercury from your dental fillings, what that does to your health and your bodily functions, and we'll ensure that you understand what risk factors could potentially be involved both for your teeth and for you by electing to have the amalgam removal procedure done. So it's not uncommon after having fillings done that your mouth can feel tender and sore, for example, and you need to be aware of that. Also, heavily filled teeth can have cracks and splits in, and we need to let you know what's going on and what the possible pros and cons are. We talk about what filling materials we're going to use and the advantages and disadvantages of all the things that we're recommending. We're going to make sure you're aware of the safety protocols, the things that we use that are designed to protect you and us, the dental team, as well as the environment from any mercury vapour, mercury pollution. We'll talk about what materials we're going to replace your fillings with, what to expect during and afterwards, and ensure that we take time to answer your questions best we can. During this, we're going to provide you with another information booklet as if you hadn't got enough in your welcome pack. And that is about dental amalgam and how to support your body during the removal process with nutrition and supplements that are specifically designed and recommended to boost your ability to actually excrete and get mercury out of the body so that you can stay well during your treatment phase. We're more than happy to work hand in hand with your doctor or your naturopath or any healthcare practitioners that are supporting you with your health at this time. We devise an individualised treatment plan, and we're going to phase your amalgam removal sessions to give you the maximum benefit and sufficient time to recover or detox and process after each visit. So as a rule of thumb, we recommend removing up to 4 amalgams in a session. Now this depends on their size, the volume and where in your mouth the fillings are, but most importantly your health. Now if you come in and you say to me, I'm very fit and well, I don't have any health issues, then we can do 4 fillings in a session. If you come in and you've got a lot of health issues, chemical sensitivities, allergies, you're on a lot of medications and you've got lots of problems, we're going to do it much slower, and we'll probably do 1 or 2 fillings at a time so we can see how you go and ensure that you stay well. So we're going to recommend as well a period of time between each of the sessions, normally about 2 to 3 weeks, and longer if your health conditions suggest you're going to benefit from taking your amalgam removal process at a steadier pace. So the amalgam removal process at Evolve Dental is always going to begin with this thorough consultation process and dental examination. And look, I know a lot of my patients do travel quite a long way to come and see us, and you're hoping to be able to get treatment started. But it's very, very important that we plan through properly, because we don't want you to have any adverse effects or any complications. We're always going to put your best interest at heart. Now, if you'd like to know more about amalgam removal, mercury fillings, the impact that they have on your health and well-being, then please feel free to contact the office. You can private message us or give us a call on 0737201811. And if you'd like to book in for a consultation to get your amalgams safely removed, then we'd love to hear from you. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is my show, the Dental Zone podcast. Thank you so much for joining me. Thank you for listening. If you have any questions or anything that you'd like to know, then hop on over to holisticdentistry.au and you can contact us from there, or you can give us a call on 0737201811 to book in for your consultation for all your dental and health needs. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.